Okay, let's go through this. Okay, uh, let's have a small glance at cranial nerves. Cranial nerves. Okay, so number one is olfactory nerve. Key things to know about olfactory nerve is going to be only cranial nerve that does not pass through the thalamus. Okay, rest of all of the cranial nerves pass through the thalamus. Okay, then it basically, the important point here is that the pathway is somewhat important to remember. It passes through the cribriform plate to enter into the olfactory bulb. Now, integration here. A patient went to Hawaii and did a lot of swimming and surfing and diving. Hours later, he suddenly becomes confused and like rapidly progressive symptoms. I know everyone's gonna jump to this and dies immediately. Okay, so the bug, just like Lana said, is Naegleria fowleri. Naegleria fowleri. Okay, there's like a house episode on this as well. Anyways, the important integration here is that Naegleria fowleri enters the brain via cribriform plate. Okay, that's I wanted to make an integration here. Then what other bug do you know that is acquired via exposure to water, like swimming? Schistosomiasis. Schistosomiasis. So look out for travel to Africa and swimming. The reservoir is basically freshwater snails. Okay, then what is the other differential when you're like swimming in some dirty water? Cryptosporidium, that's drinking dirty water. Okay, so I wanted to listen to something like what is it called, leptospirosis. Okay, this is a spirochete. Okay, so it has like a two spectrums. So number one, it can basically cause a conjunctival effusion like red eye, plus other than that, severe muscle cramps, more pronounced in the calves. Okay, the second spectrum is basically the combo of jaundice plus renal failure. Okay, and the exposure is obviously to dirty water. Okay, so you get this bug by exposure to rodent urine in the swimming pool or whatever. Okay, so like swimming is not that bad of a thing. I highly doubt it. Then final integration here I want to talk about is raccoon eyes plus battle sign plus CSF leak. What is this? Pseudomonas. Yeah, pseudomonas, you get like hot tub folliculitis. Yes, you're right. When you have like follicular papules. What is this? Raccoon eyes, battle sign, and CSF leak. What is this? It's basically known as basilar skull fracture. Okay. Most buzzwords to know this is CSF leak. Okay, like CSF leak is often going to be coming from the nose. Okay, so like you might think, this is just simple rhinorrhea. The important point here is that CSF cannot be sniffed back. Second thing, on tissue paper, it forms a halo sign. The final thing, most specific test for CSF is basically beta 2 transferrin. Okay, and the battle sign that I'm talking about here is that this Okay, this is I've seen clinically with patients as well. Okay, so it's absolutely accurate. Like this. So this is basically like you see like bruising and like hemorrhages behind the ear. Okay, this is known as battle sign. Then the final integration with olfactory nerve is basically where is it? A man can't smell and has impotence. Everyone's gonna jump at this, I know. Kalman syndrome. Okay, it is secondary to CAL1 gene mutation. As simple as that. Okay, then this is